Okay. Share screen. Okay, can you hear me? We'll start.
Yes, Prof.
Loud and clear, Doc.
So this is my third lecture, the last lecture for the year, for this semester. Actually, I just give lectures 3 or 4 times a year, okay, in the College of Public Health Master in Hospital Administration. Okay, so this is my lecture, last lecture for this class. Okay. I was asked to give this last lecture with the title Importance of Hospital Quality Accreditation, or HA202, with a time limit of 45 minutes, with the following prescribed learning objectives and outcomes. Number 1, understand the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services. Number 2, discuss the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. Number 3, develop the ability to pinpoint and isolate management administrative problems in the hospital quality control program and offer relevant solution. And lastly, draft a hospital quality management system framework pattern after ISO 9001:2015 version framework that can be used as a guide for developing a hospital-wide governance and operations manual. Let's start with the first learning objective or outcome, importance and value of adhering to the quality control standards when it comes to managing the hospital and the different services and departments. The patient client tends to go to a particular hospital because of known quality services in this hospital. I think everybody knows that. A physician client, this time it's the physician who is now the client of the hospital, tends to send his or her patients to a particular hospital, again, because of the known quality services in the hospital that he's going to send his patient to. A hospital wants to attract patient clients as well as physician clients to its hospital through its quality services. So these 3 primordial realities and practices constitute the first general driving force why a hospital and its departments and services should promote and offer quality services to its clients. Promoting and offering quality services to patient clients and physician clients should be part of the business development program of the hospital and its departments and services in attaining financial viability and sustainability. The hospital and all its departments and services should have a quality management system in place as part of its business development program. The quality management system includes defining first the quality expectations of the patient clients and the physician clients, and then finding ways on how to meet these expectations. After the quality management system has been developed, it should be institutionalized by continually doing quality control, meaning continually fulfilling the requirements of the clients and also documenting it on a manual that contains the quality control standards, which all staff, including the rank and file, should know, adhere to, and make decisions according to what is written in the manual. So aside from making the patient clients and physician clients experience and appreciate the quality services, the hospital can go for external accreditation, not only to have affirmation and validation of its quality management system, but to utilize external accreditation for marketing. Thus, the importance and value of adhering to quality control standards when it comes to managing hospitals and their different departments and services, okay, to attract patient clients and physician clients to utilize the services of the hospital because of the reputation of quality services that results from adherence to quality control standards. Let's now go to the prescribed learning outcome or objective number 2, discuss the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. Let's start first with the philosophy. Here in my lecture, I will present theories and ideas, information on hospital quality accreditation as being practiced in the Philippines. Beg your pardon for those who are in Malaysia. I have little knowledge of your system there, okay? But let's just have a discussion later on and compare the Philippine system and Malaysian system, okay? And my personal thoughts and perceptions, opinions, and recommendations on hospital quality accreditation. First of all, what is the difference between hospital licensure and hospital accreditation? Hospital licensure means obtaining an official and legal permit to operate a hospital from the Department of Health or Ministry of Health. The permit is granted after the hospital fulfills certain minimum requirement imposed by the Department of Health or Ministry of Health, and this requirement usually include those that ensure structural and operational safety and human resource, among other things. Furthermore, they may include imposition of the presence of a quality management system. The hospital accreditation is operationally defined as the processes by which a hospital voluntarily, I repeat, voluntarily applies for recognition or attestation of compliance to a certain set of standards by a third party. The standards may be anything that the hospital wants to have an external recognition of compliance and wants to use it for business development purpose. So the standards may be hospital management system, quality management system, environmental management system, disaster response, recovery and business continuity system, etc., and others. There are a lot. Thus, the main difference between hospital licensure and hospital accreditation is the required legal permit to operate. This is for licensure. And for accreditation, this is the voluntary seeking for recognition or attestation of compliance to certain standards to be used for business development. What is the difference between hospital accreditation and hospital quality accreditation? Oftentimes we encounter these two terms, hospital accreditation and hospital quality accreditation. There may be a difference, but they may loosely mean the same thing. In the strictest sense, they are different. Hospital accreditation is the process by which a hospital voluntarily applies for recognition or attestation of compliance to a certain set of standards by a third party. Here, there is no standard that is specified, okay? It can be general or anything, okay? Whereas the hospital quality accreditation, the standards sought for the accreditation is specifically the quality management system standards. Okay? As I mentioned before or earlier, hospital accreditation and hospital quality accreditation may loosely mean the same thing. Although there are various sets or subsets of standards to be assessed and accredited with, such as the generic quality management system, quality healthcare and patient safety management system, human resource management system, environmental management system, emergency and disaster management system. All these subsets may loosely be called quality management system or different types or subsets of quality management systems. So if this is the case, then hospital accreditation and hospital quality accreditation may be the same. One just have to qualify the definition of terms to be used. To further amplify on the use of the two terms, let me introduce ISO and its working on certification of standards. ISO is the acronym for International Organization for Standardization. ISO. Actually, ISO stands for isosceles. Okay. It is headquartered in Switzerland. It is the most popular and respected organization that works on standardization of things, practically everything. Okay, not only in quality management, in hospital, in industry. Okay, it defines rules and standards to aid in the task of virtually all products. I said practically all products and services that people use, including rules and standards about how products and services are made and to be done, and how quality control tests should be performed. So this is ISO. ISO has about 300 standards that organizations can seek certification from. So some examples of ISO standards which are identified by numbers. So you have ISO 9001, which is basically the quality management. ISO IEC 27000, Information Security Management System. ISO 14000, Environmental Management. ISO 31000 version 2018 risk management, ISO 50001 energy management. Another example is ISO 26000 social responsibility. In the Philippines, I don't know in Malaysia, okay, I don't have any idea. The most popular ISO standards being sought for by practically all organizations, if they want to go for ISO, okay, particularly the non-medical enterprises, meaning the non-hospitals, is the ISO 9001 or 9001, which is on quality management. The second one is ISO 14000, which is on environment, because as I said, majority of the industries, manufacturing companies go for ISO. They usually include also the environment, okay, how they produce their products in the company. Okay, an organization which has an ISO certification can specify the type. Example: Organization X has ISO 9000 certification, which means certification is on quality management system, and Organization Y has ISO 14000 certification, which means certification is on environment management. So it is incomplete when one just says an organization is ISO certified. Okay, I repeat, you don't just stop saying that the company, my hospital, is ISO certified. Okay, so one has to complete the description by specifying the type of certification. So the same thing with hospital accreditation. One should not just say the hospital is accredited. One has to specify which standards or which organization which represents the set of standards. Okay, so example will be in hospital, We are accredited by JCI, we're accredited by ACI, and others. Okay. In the Philippines, the following accreditation and certifications have been sought by hospitals. Okay. 9001, Quality Management. ISO 14,000, Environmental Management. Quality Healthcare and Patient Safety Management. This is for mainly for the hospital. Okay. Okay. Joint Commission International Accreditation. Okay. Accreditation Canada International. PhilHealth Benchbook, which is actually a must for all the hospitals. Okay. Philippine Quality Awards, this is voluntary. Okay. Total Quality Management System. Investors in People, so this is a standards for human resource management. With the various accreditation and certifications being sought for by the hospitals, when one talks of having an accreditation or certification, again, I like to emphasize one should specify, okay? So particularly if you go for ISO, you have to specify the number in the ISO. Going back to our topic, what is hospital quality accreditation? I repeat, it is the hospital's voluntary application for recognition or attestation of compliance to certain quality management system standards set up by an external organization to be used as part of the business development program of the hospital. And for the purpose of my lectures, I will be referring to the standards, ISO 9001, Quality Management, Philippine Quality Awards, which is Total Quality Management. This is the national award. Quality Healthcare and Patient Safety Management. Okay, some of the organizations or standards here are the Joint Commission International, Accreditation Canada, and PhilHealth Benchbook. So in the Philippines, we have these two in place, international standards in place. Okay. Let me backtrack a little bit. What is quality management system? ISO defines it as a management system that pertains to quality. It's as simple as that, simple definition. But what is quality? Quality is defined by ISO 9001 as the degree to which an object or entity, example, process, product, service, satisfies a specified set of attributes or requirements. Okay, so this is the more specific definition of quality by ISO. This diagram shows the current framework of ISO 9001 2015 version. This is still current. They said every 3 years, every 4 years, they update that, but up to now, it's still the same. Okay, so 2015 version is the one currently being used. Okay, so this shows the framework with customer requirements as one of the main input. Okay, and customer satisfaction as one of the main outputs. The throughput uses the plan, do, check, act cycle in the integrated elements of leadership, planning, support and operations, performance evaluation, and improvement. Okay. So formulated standards are seen in number 4. Okay. Quality management system. Number 5, leadership. So you must have some standards. You have formulate your policies and procedures based on the formulated standards of ISO. Okay, so there are stipulated standards in the ISO. So it's quality management system. There are standards set up by ISO, and then leadership, planning, support and operations, performance evaluation, and improvement. So all these circles have standards inputted inside. The Philippine Quality Awards, or PQA, as I said, this is the national award and patterned after Baldrige Okay, healthcare criteria for performance excellence. I think Malaysia is one version. Okay, pattern after Baldrige also. I don't know how it's called. Probably Malaysia Quality Awards. Okay, national awards. Okay, so this Philippine Quality Award has this total quality management or performance excellence framework. Initially, the PQA also focused on business enterprise like the ISO, the so-called business criteria for performance excellence. Now it has expanded to hospital industry. There is now a PQA healthcare criteria for performance excellence framework, and formulated standards are seen in number 1, leadership, okay, 2, strategic planning, 3, customer focus, 4, measurement, analysis, and knowledge management, 5, workforce focus, okay, number 6, operations focus, and then results. Okay. So can you see the similarities between the ISO 9001 quality management system and this one? Okay, so practically the same, no? But here in the PQA, it emphasized a lot on the results, okay, the outcome of the quality management system. Examples of quality healthcare and patient safety management standards, which are currently sought by Philippine hospitals, are the following. So these are the standards purely confined to the hospitals, okay? Unlike ISO, which started with the industry, but now expanded to hospital also, PQA also, industry, and then hospital. But this JCI, PhilHealth Bench Book, and Accreditation Canada, okay, are hospital-based from the very start. Okay, so comparing the 3 hospital accreditation, okay, all are inherently for hospital accreditation. So no industry can go for this. Okay. All 3 emphasize quality, healthcare, and patient safety. And all 3 have 2 major categories of standards, namely patient-centered standards and the healthcare organization management standards. Okay. So here it's not specified in PhilHealth Bench Book, but you can see the the categorization of all the items here. Some of them will fall under patient-centered standards, example, patient care, okay, and then the others, okay. Now for the healthcare organization standards, you have leadership, human resource, information, safe practice. Okay. Actually, in the PhilHealth Handbook, they simplify it. They still do not want to follow completely the Joint Commission internationally because it's quite difficult. In Accreditation Canada, you can also see these 2 categories: individual client patient care group 14, so under patient-centered standards, then information management, human resource, environmental leadership under the healthcare organization management system. So that's why I said the standards here basically are classified into 2 groups: patient-centered and healthcare organization management standards. Accreditation fees. Hospital accreditation almost always entails fees. There's the fee for the survey or the assessment, and then there's the fee for the certificate. So how much fees are? This is usually dependent on the accrediting body. This table shows the various accreditation fees. Take a look. So they range from 10,000 for PhilHealth to 14 million pesos. This is in pesos, not in Malaysia. Okay. 14 million pesos for Joint Commission International and 8 million for JCI. ACI, okay? So for Philippine Quality Awards, 30,000 for small organization, 50,000 for medium to big organization, and then ISO about 300,000 pesos, okay? I don't know whether there'll be increase on these rates because of the increase in everything, gas, electricity, etc., okay? What are the currently sought accreditation by hospitals in the Philippines and advantages and recommendation? As I said, sorry, I'll just concentrate my lecture on the Philippines. Later, we'll have discussions with the Malaysian students and see a comparison. I hope they can share their experience with me. Okay. So in the Philippines PhilHealth Benchbook, so this is the local standards directly related to the Philippine hospitals. It will be needed for licensure, okay, with the by the Department of Health. My personal recommendation is that all hospitals must have for viability and sustainability reasons, okay? Because practically all Filipinos are subscribed to PhilHealth. Okay. The Joint Commission International and Accreditation Canada International. So these are international accreditations directly related to the hospital, recognized internationally and prestigious. My personal recommendation is just to go for one if you have to, especially if you have a medical tourism project and you need leverage with the international collaborators and partners to get clients from abroad. Okay. ISO 9001, this is an international standards on basic management, quality management system that are applicable to all kinds of industries, including hospitals and healthcare. My personal recommendation, go for it if an international accreditation is deemed needed and you cannot afford ACI or JCI. Okay. For the Philippine Quality Awards, okay, or the national awards, okay, this is a local standards which covers all kinds of industry. Again, as I said, there's a specific set of standards now for healthcare. My personal recommendation, go for it if you want to have the highest, the most prestigious quality awards in the Philippines, as this is awarded by the President of the Philippines. Okay. I guess in Malaysia, if there is one, it is also awarded by the Prime Minister of Malaysia. Objectives of the hospital quality accreditation. The general and overarching objective will be hospital quality accreditations are used for business development program of the hospitals to enhance the reputation so as to attract more patient clients and physician clients to utilize their services, thus promoting financial viability and sustainability. The specific objectives: to increase the hospital credibility and to demonstrate its accountability to the community using an attained hospital accreditation, to increase its leverage with the potential partners and collaborators in the healthcare industry using the attained hospital accreditation. Other specific objectives: to use the accreditation project as an assessment tool on hospital performance as well as a change management tool, to identify and institute areas of improvement towards excellence with the help of hospital accreditation project, and lastly, to educate the staff on performance excellence with the help of the hospital accreditation project. The structure of the hospital accreditation. The hospital quality accreditation can be looked at as a program or a project. It can be on a temporary or permanent basis, but my recommendation is that it should be on a permanent basis once the hospital administration has decided to go for hospital quality accreditation. First reason is that the accreditation is usually for a limited time period only, renewable, okay, it has to be renewed every 3 years to maintain the accreditation. 2, there is a need to continually train staff on the quality management system and continually monitor conformance to the standards, which usually goes on throughout the life course of the hospital. Okay. The hospital administration can either create a committee or an office for the hospital quality accreditation program or project. Committee if the program would be short-term. Office if the program would be on the long-term basis. As to the staffing of the hospital quality accreditation, strictly speaking, all staff should be involved. Okay, all staff in the hospital, from top management to the rank and file, all working in an aligned and integrated fashion towards attainment of the external recognition. To orchestrate or direct the hospital quality accreditation program, committee or office may be created. The staff in this committee or office will be those knowledgeable on hospital accreditation process and who can teach the rest of the hospital staff on quality management system, particularly on how to fulfill the requirements of the required standards by the accrediting bodies and who have leadership and managerial skills. Since the hospital quality accreditation program is a hospital program and hospital-wide, all staff should be engaged, aligned, coordinating, collaborating, and integrating with each other to promote the success of the program. So a steering committee should have a multi-sectoral membership. So there will be participatory management. Cross-sectional or cross-sectoral membership with representatives from key functional areas in the hospitals in the following areas, such as medical service director, nursing service director, ancillaries medical service director, administrative, human resource, business development sector, finance sector, and the secretariat to help in the everyday paperwork or coordination. As to the policies of the hospital quality accreditation, the primordial policy is that once the hospital quality accreditation project or program has been decided to be set up, all hospital or all staff of the hospital, from the top management, the middle management, to the rank and file, should be working in an aligned and integrated fashion towards attainment of the external recognition. The other basic policies that should be covered: what are the authorized functions and authorities of the Hospital Quality Accreditation Committee or Office? What are the punishment and rewards for non-conformities and excellent conformities, respectively, on established quality management standards? Systems of hospital quality accreditation. This invokes system thinking and system approach. We have discussed about system thinking and system approach before. Okay, so all departments and services should be involved in the hospital quality accreditation project or program. All departments and services should be aligned, coordinating, collaborating, and integrating with each other in the hospital quality accreditation program or project, so as to ensure attainment of the external recognition. So it goes without saying that all the quality management systems of all the departments and services should be aligned and integrated also with each other to attain the highest degree of quality. As to the methods of the hospital quality accreditation, okay, so top management decides to have a hospital quality accreditation project or program, and then with the following objectives: to promote business development program so as to make it viable and sustainable, to use it as a change agent to fast-track quality improvement, okay, and top management creates a steering committee or a committee, a team or committee or an office, okay, for hospital quality accreditation project with clear functions and authority. Membership: senior management representative, if not the hospital director, okay, and then chair with competency in hospital accreditation and leadership, and then cross-sectoral or multi-sectoral membership with representatives from the key functional areas in the hospitals. Okay. So I mentioned this already, the composition of the multi-sectoral membership. So the steering committee formulates the master plan for the project, and then it decides on the set of standards to be assessed and evaluated by an accrediting body, okay, whether it will go for JCI right away or it will go for ISO first. Okay, they have to decide on this. The steering team seeks commitment for support and collaboration from the top, senior, middle, and lower management on the project. The road to hospital quality accreditation, how necessary and who cares? This is a common question, okay, being asked. Okay. The general answer is it depends on your need and situation. Okay, this is my answer. It depends on your need and situation. If there is a need, to participate in the National Health Insurance Program and get benefits, you go for the PhilHealth accreditation. If there is the need to participate in medical tourism program and get benefits, you can go for an international accreditation. You can consider ISO, JCI, ACI, and probably there are others which will come up because it's very competitive. You can have Australian International Commission, Accreditation International. You can also have some from India, okay? And then the third reason is a need to satisfy requirements of corporate accounts, okay? Then you go for accreditation. If there is a need to satisfy the expectations, suppose your community expecting you to have an accreditation, then you go for accreditation. Again, the last is if you want to be known as the best hospital with performance excellence, then you can go for the highest national awards, which is the Philippine Quality Awards. As to the situation, if there is a situation to be with a trend, having an international accreditation, not to be left out, strong community expectation, then go for accreditation. If there is a situation such that you want to fast track the improvement of the quality and safety of operations and services with accreditation, then go for accreditation. Okay, so this would include assessment, training, improvement, and evaluation. If there is no need and no situation, it's enough that you just be compliant with the standards and criteria without going for the formal accreditation. Okay. Just accomplish compliance with all the different standards that you can get hold of. Okay. Anyway, it's publicized. Do self-directed learning and do improvement on your own. So one can study all the stipulated standards in the different sets of published quality standards, which are readily available in the internet and come out with an integrated checklist. Then comply through self-directed learning and training and continuous improvement. Okay. So we have covered all the items in number 2, which is the longest prescribed learning outcomes. Okay. Let's now proceed to number 3, okay, which is to develop the ability to pinpoint and isolate management and administrative problems in the hospital quality control program and offer relevant solutions. Here I will share with you common problems which I have encountered personally and the suggested strategic solutions. I shall categorize the common problems into 3 phases: the pre-hospital quality accreditation phase, the hospital quality accreditation phase, and the post-quality hospital quality accreditation phase. It's the same like pre-op, intra-op, and post-op, okay? There are problems that cut across the 3 phases, meaning problems that are present in the 3 phases or problems in the earlier phase that may persist or spill over to the next phase or phases, and problems predominantly present in a particular phase. So there will be overlaps. Here is a list of what I think are the common problems in the hospital quality control program. Varying perception and definition of quality of clients and hospital and department staff. Established mindsets and habits of staff from top management to managers and rank and files, where the call for change for improvement is difficult. Number 3, the cost of accreditation, as accreditation entails cost. Number 4, inherent difficulty in developing and institutionalizing a comprehensive, aligned, and integrated quality management system in a hospital. I'll expound on this one by one. The foremost problem or challenge is the varying perceptions and definitions of quality of clients and the hospital staff. Okay, so patient clients have their own perceptions and definitions of quality. Physician clients have their own definitions, perceptions of quality, and the other staff in the hospital have their own perceptions and definitions of quality. To show you that this is the case, in 2010, I made a survey on the perception of hospital administrators, physicians, non-physician healthcare professionals. Okay, so these are the PT, nurses, okay, and patients on the parameters of excellence or quality in the hospital. There was a total of 141 respondents, okay, 34 hospital administrators, 34 MDs, 39 non-physician healthcare professionals, and then 34 patients. So as expected, I got varied response from one group of respondents to another. Collated responses revealed 59 specific parameters of excellence, that is very many, okay, which can be grouped into 11 categories. So these are the 11 categories. Okay. The greatest majority of respondents place infrastructure and facilities as the #1 excellent parameter. Next, the medical equipment and drugs, then governance, with excellent service as #4. So you can see how varied the response were. On the specific parameters on the infrastructure and facilities, there were varied perceptions again of the quality among the different groups of respondents. So just to cite 2 examples, a great majority of the non-medical staff put significant weight on the modern infrastructure and facilities compared to the medical staff. Okay. The hospital administrators, physicians, and non-medical staff put significant weight on complete and well-maintained infrastructure and facilities compared to the patients. Okay. On the specific parameters on services, again, there are varied perceptions. Again, to cite 2 examples, the physician and non-medical staff put significant weight on complete and efficient services compared to the patients. The physicians put significant weight on the presence of multidisciplinary services compared to the non-medical staff and the patients. So how do you resolve the varying perceptions and definitions of quality of clients and of the hospital and department staff? That's the challenge. Okay. A suggested strategic solution, hospitals should look at the perception and definitions of quality of the clients, patients, and also the physicians, and also the hospital staff to try to meet the requirements as indicated and as appropriate. In the ISO quality management system, the starting points are always the determination of the customer requirements and the needs and expectations of relevant interested parties. So you can see the circle here on the left side of the diagram. Customer requirements, needs, and expectation of the varying relevant interested parties. In the PQA, the customer focus, okay, requires the organization or the hospital to determine the requirements, expectations, and preferences of the customers. Customers could be the patients or the physician clients. Okay. The standards have these three items: the so-called voice of the customer, listening to the customer, listening to current customers, and listening to potential customers. So in reality or real practice, it is extremely difficult to get uniformity on the needs of patient clients as well as physician clients, as they always have varying perception, definitions, and mindsets. Thus, to support the search for customer or clients' needs, a suggested strategic solution is to look for the current standards of quality in hospital management, abroad and at home, and adjust accordingly and use this to manage the expectations of the patient clients and physician clients through education and changing their mindsets. The second most common problem or challenge is the established mindsets and habits of staff from top management to managers to rank and file, where the call for change for improvement is extremely difficult. Common contributing mindsets are: if it ain't broke, don't fix it anymore. Don't disturb our current comfort zone. The situation is particularly true where the hospital is currently financially stable, regardless of the status of its quality management system, and the owners and the leaders are not wary of the threats to financial sustainability from other competing hospitals in the future. These hospitals tend to preserve the status quo without continually improving their quality management system, and more so without going for hospital accreditation, particularly when the cost of accreditation is considered or factored in. For this problem or challenge on established mindsets and habits of complacency, and without putting utmost importance to the hospital quality program, improvement or change in the governance, leadership direction is very crucial. So the leaders and the owners should first realize the importance of an excellent hospital control program in promoting financial sustainability. After realizing this and subscribing to it, they should take the lead, convince, and educate all the staff to pursue an excellent quality management system with or without accreditation. As I said, it can be without accreditation as long as they are following the standards of quality. The cost, another problem. Cost of hospital quality accreditation is a common and realistic challenge. As I said, accreditation entails cost. Okay, so here, take a look again at the cost. The range is 10,000 to 14,000 based on this table. Okay, so this just shows the cost of the initial accreditation. If you have to maintain your accreditation every 3 years, that entails another cost. My suggested strategic solution is to look objectively at the indications for the hospital quality accreditation. As I said, one may not need a hospital quality accreditation if one can do self-directed learning, training, and improvement. So remember these slides that I presented earlier. If there is no need, no situation indications, okay, just be compliant, doing self-directed learning. Okay. Again, this slide, if there's a need, so look at the indications. If there's a situation, again, look at the indications based on the situations. Okay. So the last challenge, which is the most challenging of all the 4 that I mentioned, because you're dealing with people, okay, But okay, first of all, the challenge is the quality management system itself. As I said, it is not easy. It is inherently difficult. It is extremely difficult, especially if one is to develop and institutionalize a total quality management system involving the whole hospital and involving the whole staff, which is the most challenging, with varying healthcare professionals and non-healthcare support staff, and where alignment and integration are the key results areas and performance indicators. Now, the challenge starts with the formulation of the blueprint of the quality management system in its department and service, including the governance body or board of directors. Then the challenge is to make this quality management system of all the departments and services aligned and integrated with each other. And then the implementation itself, where there must be demonstration of aligned and integrated activities and behaviors of all the staff, and then monitoring for conformity, for non-conformities or conformities, and then lastly, formal evaluation of the quality management system at planned intervals, say yearly or every 2 years, with formulation and implementation of continual improvement program. Very challenging. Challenges in the implementation: all staff from top management to middle managers and rank and file should be engaged, committed, and trained in the formulation of the blueprint, implementation and evaluation, and continual improvement of the quality management system. As I said, it's a tall order. Okay. They should be aligned, all the staff should be aligned, coordinating, collaborating, and integrating with each other in accomplishing a total quality management system. The usual findings in hospitals, based on my experience, is the so-called Mingas Kugon or Kugon, okay? So burning of Kugon grass that only burns brightly after the first few seconds it was lit, then initially showing great enthusiasm only for it to fade away as time goes on. So it's really a tall order that you need strong leadership and extensive training. Okay. Incomplete and incomprehensive, not aligned, and not integrated quality management system is another challenge that I usually see. And then hiding of non-conformities to stipulated policies and procedures by the staff. Okay, hiding. Okay. In those for surveillance visit, after the initial accreditation, suppose they got the accreditation, they have to be follow through. The staff will work double time to ensure passing by covering up on non-conformities and catching up on fulfilling requirements of standards rather than doing them on a daily basis. This is just to pass the surveillance. So before I end this section, let me again list the common problems that I have observed: varying perceptions, definitions of quality, established mindsets and habits of the staff at all levels, and then cost of the accreditation, and then inherent difficulty in developing and institutionalizing a comprehensive, aligned, integrated quality management system in the hospital. We now go to the prescribed learning outcome number 4, which is the last one. Okay. Okay. Draft a hospital management system framework pattern after ISO 9001-2015 framework that can be used as a guide for developing a hospital-wide operations manual. Okay. So this is the ISO 9001-2015 version, okay, that can be used as a guide, as a starting point to draft the quality management system of the hospital. Okay. One has just, as I said, used that as a guide, then just put in the description, put in the description elements, preferably. I just converted the diagram earlier into this one, so it's easier to look at. So you just have put in the description, elements, and preferably a management system in each of the boxes that are mentioned in the ISO 9001, 2001, 2015 framework. One can read the stipulated standards, as I said, they're published, PhilHealth Benchbook, JCI or ACI, PQA, and then all of these standards, then incorporate or integrate them into the ISO standards or boxes as applicable, okay? This is an example of an adapted framework from ISO 9001, 2015, which I'm now using, okay? It can be used as a hospital governance and operations manual, as well as for the hospital quality and safety management system. The quality and safety management system is used instead of just quality management system is to meet the requirements of the PhilHealth Benchbook, ACI, and JCI, because they put a lot of, they want to have emphasis by the hospital on the safety of the patients. As mentioned earlier, one has just to put in description, elements, and preferably a management system in each of the boxes provided, guided by the compliant of the established standards of in ISO, PhilHealth, JCI, ACI, PQA. So once done, the whole manual shall be the hospital manual for quality and safety management system. At the same time, it can serve as the hospital manual of governance and operations. Okay. So guided by the established standards, put everything in terms of a management system so that you have a system thinking approach, system perspective. Okay. So preferably there must be write-ups on each box and standards in the format of a management system. Example, so in the client requirement in one of the boxes of the ISO standards, you put client requirements management system, the legal requirement management system, client engagement, performance excellence, leadership, planning, support, workforce. Okay, so there must be a development of a manual on this. Okay, so here is a template in writing the management system of its standards. Okay, with the following content. So the title, example, you have the client engagement management system, then concept, meanings, definitions, and scope of client engagement. Okay, rationale, purpose, policies, procedures, work instructions, review of policies, how the policies, procedures, and work instructions will be reviewed as a matter of policy. And then what are the policies for non-adherence by the staff on established policies, procedures, and work instructions. Then at the end of the document, you put their notation on the number, the version, the date, released and prepared and approved by a person. Okay. To end my presentation, I will flash again the prescribed learning outcomes and objectives, which I have covered. Okay, understand the importance and value of adhering to quality control standards. Okay, discuss the philosophy, objectives, structure, staffing, policies, systems, and methods. Ability to pinpoint the and isolate management, administrative problems, and then draft a hospital quality management system framework pattern after ISO 9001, 2015 framework that can be used as a guide. Okay. So with that, I end my lecture. I really hope you have acquired the prescribed learning outcomes throughout my presentations. Thank you for your kind attention.
First of all, thank you, Dr. Hawson, for a very comprehensive and very interesting lecture. So reminder, we will now enter our question and answer portion. For those who want to have to ask questions, to give their comments, reactions, or their experiences, for the sake of discussion, and for the sake of organization, kindly use the raise hand reaction, and I will call you in order. Okay, let me just Hold on. Uh, I say I will call you in order, but I don't know the who was first. Hold on.
We can look at the comments first. If you look at the comments,
Okay. Um,
there's a comment by Sutar. No,
yes.
accredit
Sige, Doc. Go ahead.
accreditation by the Malaysian Society for Quality in Healthcare, I suppose. Okay, so we have equivalent here, no? Philippine Society in Quality Healthcare, but this is a private organization, non-NGO, not the government. I don't know whether this is for the hospital, for the government. This is for the government, MSQH, government.
For both, even private will invite them. So public and private.
This is established by the government.
Yes, yes.
Okay. So, but ours is, we call it PISQA, Philippine Society for Quality in Healthcare. This is a private organization trying to promote quality standards in healthcare organizations. Okay. Anyway, okay, here the district hospital without specialists costs accreditation 500,000. That's very expensive now. Okay, 500,000. Okay, so that's a sharing from our Malaysian friends. Of course, you can share your experience in accreditation in your hospital, Sutar, later on. Okay, so Sidoti, okay. I think the major turn-off for a hospital staff, especially for doctors, is the paperwork needed to comply with the quality standards. That's true. Is there an easier way to go around this in paperwork? Okay. Well, you can remedy this by doing it. Okay. Do it at the very start of the. Okay. There are two situations here. Okay. One, if you're just starting, and then one, you have already started, so it's hard to convince the people to write, to do all the paperwork. No? But again, bottom line here is somebody will have to provide guidance. No? Okay, just like when I was the quality representative of Manila Doctors, I also have, we're about 40 years in existence. So we decided to go for ISO. So it's hard to get all the people, all the doctors to write all the manual. So we just provide template and then assist them. Okay. So once it has been done, but make sure the template is comprehensive, it's complete, so that you can use it for as long as you want. You just revise it or add a little to the manual. No? So everything will be easy now. No? Now for the new hospital, I think you have to start from scratch. Now come out with a template that you can use, parang sort of a long range planning, a template that can be used as long as possible. Okay, in the long run. No? Okay, so it's just a matter of changing some of the items, in updating, revising. No? The main accrediting body in the Malaysia is Malaysian Society for Quality in Health. Okay, it's an NGO. Okay. Does accreditation equal to cost effectiveness and improve outcomes in the hospital? Okay, that's a big question. Okay, okay. So that's why I said that's why there was a question being asked. Is it necessary? Is it needed? No, that's part of it. No, okay. So there are a lot of hospitals without quality accreditation, but they are earning. Okay, they have good outcomes in terms of financials. No, okay, okay. Of course, if you have a quality management system in place, and especially if you are accredited, okay, so tendency is to come out with a management system that will promote cost effectiveness. Okay, unless you decide to just center on the business part. Okay, that can also be done. Okay, nobody will blame you for that as long as it's written down as policies and procedure. Okay, but if you want to promote cost effectiveness in your system, you can do it through your quality management system standards, your operations manual. Okay, so at the moment, it's the Philippine quality among the hospitals. Okay, among the hospitals with accreditation like JCI, ACI, we really don't know whether it really have a direct impact on the outcome, on the at least on the bottom line. No, okay, we don't know. No, okay. So, but theoretically, if you have a good quality management system, it should. No, and the only organization which look at this outcome will be the Philippine Quality Awards. Okay, as I said earlier, the Philippine Quality Awards put emphasis on the results, no? A lot of emphasis, but the rest of the accreditation standards like ACI, JCI, ACI, they look at the process. They look at the process only, not putting a lot of importance on the results. Okay, so in the Philippine Quality Award, let's say if you have the standards and then you are earning, you are the leader in the community because of your income, because of your competitiveness, that will be recognized. So you get the highest achievement awards, which is the certificate of performance excellence. Okay, so if you have not achieved that, you get a lower certificate of accomplishment, certificate of proficiency, certificate of mastery. Okay, so unlike the other standards, they just said pass or fail. ISO is they visit, they audit you. If you have some non-conformance, they ask you to remedy it within 6 months. Then you get your standards. Okay, you get your accreditation. Now, JCI, the same. Okay, they visit you, they assess you. Okay, if you lack something, your non-conformance, they give you a chance because this is a secret. They want to maintain their income. Okay, they want to maintain their business. So they usually give you a chance. Then you work for it, so you pay, but you maintain the name that you are so and so accredited. Okay, just to promote your business. No? Okay, so that's why I said the best award will be the Philippine Quality Award. No? It's an honest to goodness accreditation body. No? So where am I, Patrick? I lost track of all the questions.
Yes, there is a question from Harold. Is there a particular template used for the manual?
No particular. When you say particular, I have my templates, which I share with a lot of hospitals already. No? Okay. I create my own template. No? But there's no, you can, if you look at the internet, there are a lot of templates that you can also use. No? Okay.
Okay. Next question from Sir Stephen. Are there direct benefits to the staff being accredited? Will there be a subsequent increase in salaries, or are there monetary benefits? Very interesting. What ways can we motivate our staff to be engaged in accreditation?
Unless the private hospital is generous and then will give you incentives or benefits, that's it. But most of the time there is none. From the in terms of salary increase, I don't think so. No. Okay. Monetary benefits, none at the moment. At the moment. No? So what way can you motivate our staff to be engaged in accreditation? Well, the only way to motivate your staff is to make them realize that the improvement that can happen with improvement of the quality management system in terms of efficiency, in terms of patient safety, etc., etc. And then probably if there are a lot of patients coming in, you have increased patient load, patient clients because of the accreditation. That's another form of motivation that can happen. Okay.
Okay. Since we're doing questions from the chat, Doc, is it okay if we move on? We leave that aside for now,
Yeah,
and then go to those who are raising their hands.
sure.
Baka nangangawit na po.
Uh,
Okay, so Ma'am Zoraida, you are raising your hand. Do you have a question?
Thank you, sir. Good afternoon, morning. Dr. Hoson, sir, I work in one of the JCI hospitals, and I'm actually head of the section of minimally invasive gynecologic surgery there. So the problem is JCI does not look into the quality. And this medical center where I work is actually promoting medical tourism. And the promotion is the robotic surgery. If you're familiar with the robotic surgery in gynecologic endoscopy,
yeah. Yeah.
well, the promotion is medical tourism for robotics. And my dilemma is that the staff who had 2 weeks training in robotics performed surgery for a, say, 3-centimeter dermoid cyst when you can do it by conventional laparoscopy.
Mhm.
And I brought this into the attention of the top management because of medical ethics. The patients do not know that this condition can be managed at a much lower cost because the package for robotic surgery in my center is 1.7 million. But you can do the same procedure for 300,000 pesos. But the top management is not into the medical ethics because of financial sustainability or viability, and also because of medical tourism. So, sir, as section head, what can I do to convince top management also to put medical ethics side by side with JCI accreditation and financial sustainability and ROI?
Okay. Okay. I got. I heard you mention about JCI is not respecting your what do you call that? The thing that you're doing is not supporting.
Yes, sir, because JCI only requires certificate of training. So they have a certificate of training from USA that they did the 2 weeks of robotic surgery. We also have a local accreditation for gyneendoscopy, and they do not follow that because JCI only recognizes the certificate of training coming from a facility in the US.
You talk about JCI, huh?
Yes, sir.
I'm
JCI.
surprised. I'm surprised because JCI should go by the process because it's international, no? It's international. They go by the process. It should not dictate to you how you should be trained, how you should be operating, no? How what will be your medical management, no? Okay, that's another issue, no?
Yes, sir. I was also surprised because they just look at the certificate of training of the staff and not if this consultant is certified locally by the local society.
Yeah, if they're certified by the local society, that's good
They
enough.
don't recognize that. They do not put that into account because these practitioners are not certified by the local society.
Practitioners, the one doing robotic are not certified.
Yes, sir. They are not.
But
they have certification from the US facility that they had training, and that was recognized by JCI.
what's the national policy? What's the policy in the hospital in the entire Philippines?
Well, they should not be practicing, but institutional policy where I work, the top management recognized the JCI.
Yeah, but do they does your top management recognize also the ones who train abroad and who are allowed to perform? Because
yes, unfortunately, yes.
Yes, hindi pwede na. So because there's such thing as staff accreditation and what do you call that? You allow them, you authorize them to practice, to perform certain operations, right?
Yes, but the medical ethics, sir, of performing such surgery, very costly. Let's promote medical tourism. So I know that the procedure can be done by conventional laparoscopy.
Yeah. Okay, that's the
Yes.
second issue that I want to deal with. Now, I just separate the JCI first. The JCI they should have a good reason for not. I hope they did not just because of that they did not grant you accreditation. No, di ba? They just tell you you have to improve on that. We will give your accreditation afterwards.
Yes, we were given another 3 years of accreditation.
Okay, that means they gave it already to you. That's good.
Yes.
Okay, they just make some comments. As I said, those business-driven accreditation usually are a little lenient now because they have to maintain their business. They will tell you, okay, you're not conformant, but you try to remedy it as soon as possible. Then we'll give it back. We'll give you your accreditation. Now, okay. Now regarding the costly part, remember, okay, I think the basic issue is whether the patient is informed or not. Now, okay. So if the patient is I don't think it well more on the medical ethic. It's really more on patient's advice. Now, you advise the patient, okay, dermoid cyst. You tell them, have you seen the manuscript that I sent to you last Monday on the management of a patient process?
Yes, sir.
Okay. So you just
And I made the reaction paper on that also.
okay, good. Okay. So in there, so you have a dermoid cyst, right? Okay. So it has to be removed. Okay. So you tell the patient these are the options. Okay. Options 1, open. Option 2 is robotic. Option 3 is laparoscopic, whatever, no? Other methods. And then tell the patients what are the benefit, risk, cost, availability. No? Okay. Availability should be inputted because there are some hospitals which don't have robotic. Okay. So then ask the patient to decide. If the patient says, okay, I want the robotic, no, even if it costs me 1 million something, no problem. There's no problem. There's informed consent. No? Okay. So as long as you pass through that, if you make that as your guideline, that's why I said the one that I showed to you, management of a patient process, should be adopted by all hospitals because it will cover the entire things. No? Okay. So to give the doctors the leeway now to do what they have to do, but as long as there is informed consent on the part of the patient. Okay. So if you have documented that you explain properly, so in JCI, you have to educate the patient, tell the relatives what are supposed to be done. And then if they then get their consent, okay? So if they sign the consent, no problem already. So that's not part of ethics anymore.
Apparently, sir, that patient was not told about the conventional laparoscopic surgery because morbidity happened. That's why it was brought into my attention. So we learned that the patient was not informed about the much lesser cost of conventional.
Okay.
She was not informed properly. So in my reaction paper, sir, I actually put that there's failure in the patient process of properly informing the patient about the options because of this medical tourism, because the center is promoting robotic surgery as part of medical tourism. So the patients are not being informed that there's another form of surgery which is less costlier than the robotics. So in my reaction paper, sir, that I put that at the end of the day, it always comes to financial or revenue generation for these centers who are seeking JCI.
Yeah, okay. So, but you agree?
Business, it's all business.
Well, but you agree with me, there must be a explanation on the page.
Yes, sir.
Give the data, the information, let them decide. No? Okay. Because it's the same way as it's the same situation as in a setting in which a gynae does not do robotic, he just do open now, and then he did not explain to the patient that there's an option to do robotic. Okay. Okay, so if the patient hears that, okay, why didn't you tell me that there's robotic? If you tell me there's robotic, I might go for it. Yeah. Okay. So that patient might also be dissatisfied with the gynae doing the open. No? Okay. That's why in my practice, I don't do laparoscopic surgery. I do open cholecystectomy, but I usually tell the patients what they want. No? Okay. If they decide for lap, I refer them to somebody else. No? Okay.
Thank you, sir.
Okay.
Okay, thank you for that very meaningful discussion. So I see no hands raised, so we'll proceed with the chat again. So Dr. Ish has a comment. In Malaysia, it is compulsory for a government hospital to have accreditation. It's either MS-ISO and or MSQH.
Good.
Okay,
Thank you.
thank you, Dr. Ish.
We have
Ma'am,
question. Do you have a national awards? Malaysia National Award, Quality Award?
Good morning, Prof. Thank you for your lecture. I don't really see it being to the forefront. I mean, they're not promoting the award per se, so we're not really aware of it. But it's for private healthcare, there is a lot of awards, but for government, no. Normally, it's just internal certification. For example, the hospital kitchen can be certified, and the hospital can be like a baby-friendly, like internal accreditations, like baby-friendly hospital, father-friendly hospital, that kind of things. And then the equivalent of JCI in Malaysia is MSQH. It's like the same thing, but there are, I think, only one private hospital in Malaysia with JCI, if I'm not mistaken. There's only one. The rest of us all either go for MSQH or MSISO. Thank you, Prof.
Okay. About for the I don't think the hospitals are going for the national award because this national award is really is catering more on the industry, on the on the industrial companies. No, have you heard of that? None, I suppose. Okay. So there could be, most likely there will be, because there's such thing as Japan national awards, no? Okay, Malaysian, probably Indonesian national award, no? So we have the Philippine Quality Awards, no? Okay. Okay, thank you.
okay, thank you for that. Ma'am Lydia has a question. So doctors' participation in accreditation is a challenge in many hospitals. Is it because the accreditation does not directly impact patient outcome?
Challenge, as Dottie mentioned, a lot of them would be paperwork. You have to establish a lot of documents, no? The policies and procedures, and then you have to adhere to that. Okay. If you're talking about doctors, we know doctors that have their very individualistic mind. They do things on their own. Okay. So they don't usually want to follow. Okay. Okay. So that's the role. No? So because in accreditation, you must establish policies and procedures, which all of you will have to be aware of and understand and then conform to it. No? Okay. That's probably the challenge. No? Okay.
And to add to that po, by my experience, ang experience ko po kasi implementing health information systems. So doctors are already lead hectic lives. And if you add more to the work that they have to do, they will really resist it, whatever it is. So complying with standards in health information, for example, especially if it's quote unquote out of the way of their practice, they won't like it, basically, unless they are especially tuned or they have an affinity towards standardization.
Yeah, that's
Okay.
okay, especially medical, electronic medical recording, etc.
Yes, there's a lot of work and training and getting used to the system, and they don't like it, basically.
Yeah.
Okay. Sir Suthar has a comment. MSQH is a collaboration between Malaysian Ministry of Health and Malaysian Medical Association and Association of Private Hospitals of Malaysia. The MOU was signed in the year 1999, and the standards were developed together with universities and the WHO. Okay, thank you for that
Thank you.
comment.
Thank you for that info.
Sir Harold James has a question. Dr. Hawson, JCI and ACI accreditations can be good marketing tool to attract patients. Do we have proof on ROI, or are there any studies proving that these accreditations can be the preference of patients or the community?
I'm sorry, I don't have information, and I have a feeling there is no study on this. Okay, if there are, probably it's internal. They don't like to publish it. Okay, so there are only about how many JCI hospital in the Philippines? About 7 or 8. Then 2 ACI. No, okay. So as I said, I cannot really say whether it's getting the JCI, ACI is equivalent to or contributed to the increased income of the hospital or the reputation. Okay. In terms of reputation, I don't think so, because in the Philippines, the Filipino culture is that they go to hospitals where their doctors are, not really the hospital per se. No? Okay, that's the primary driving factor. They go to doctors whom they are familiar with, they know, okay, rather than the hospital is accredited with JCI or ACI. No? Okay. So now, in terms of outcomes, we don't have any data on that. No?
Okay, thank you for that. Eliza Marie Royo has a question. Hi, Dr. Hawson. With regards to the varying perceptions and definitions of quality by the patients, physicians, healthcare administrators, the survey you showed us in the lecture was very interesting. Do you think that it would be much better if our hospitals have standardized quality measures for this?
All hospitals? Okay. There's always an attempt to standardize everything, but it's really a challenge. Okay. So standardization can make use of the it's hard to define also standardization. Standardization by structure, by policies and procedures. Probably processes will be easier to standardize. No? That's why ISO usually go by the process, not by the specific, let's say, infrastructure. They don't have to have the same facade, same architectural design, etc. No? But they put importance on the processes: patients management, safety process, quality management, process, etc. Okay. That's why I said the one that I gave you, management of a patient process. If only all the hospitals can adopt it, that's the motherhood process. Then from there, you can integrate some of the known established guidelines that you know of, and then put it inside now. So that will become a standardized process already. Okay. Did I answer your question?
Yes, Doc. Thank you po.
Okay, thank you very much. Sir Harold James has a comment. 8 million and 14 million is a huge investment. You need to tuck it in all costing of services.
That's true.
Thank you for that.
Okay.
Dr. Sherhan has a question. Is there any ruling that the hospital is that it is compulsory for a hospital to have accreditation in the Philippines?
As I said, hospital accreditation is voluntary. Okay. So you're not required to have ACI, JCI, ISO. Now, for the PhilHealth bench book, strictly speaking, you're not required, but you are automatically forced to, because practically all the hospitals will go for PhilHealth accreditation, and people will flock into the hospital. The Filipino patients will flock into the hospitals. So if you don't want to lose out on the benefit from the PhilHealth accreditation, you really have to go for PhilHealth Bench 2, the basic one. Okay. There are actually, before there were several levels of PhilHealth accreditation. You have the quality, safety, excellence, etc. But they have forgotten about the higher level. They stuck to the basic. No? The basic is very easy to comply also. So at the moment, practically speaking, the only thing that you will be forced to, but strictly speaking, you are not required, is the PhilHealth Bench book. No?
Okay, thank you. Sir Karunagaran has a comment. There are certain specifications in hospital accreditations that can't be achieved due to constraints in hospital itself. For example, human resources, financial. For example, in a ward, there is specifications mentioned that there must be reports compiled, CPG available, and trained staff. It puts under the it's put under the responsibility of ward sister and nurses, where they have clinical tasks to do as well. They sometimes even have to work extra hours to make sure the specifications are completed. Thank you for that. As mentioned, keeping up with standards and specifications are mostly more work, and so that sometimes causes resistance from the staff. Thank you for that comment.
Yeah, that's true. That's another example of challenges that you have to meet and then manage. Okay. If you
Yes.
cannot go for the specification, the standards, don't go for it yet, and then try your best as long as you are achieving the outcome, like patient performance excellence. No, you can have performance excellence without going for the accreditation. No, okay. Then you have the client engagement, and then you have maximal utilization of your services. No, okay. Slowly try to meet up with the established standards which you think are acceptable to your setting. Okay, any more, Patrick?
Okay. Yes. Dr. Benjamin has a comment. Thanks, Dr. Hoson, for the lecture. In accrediting the training of a department in a hospital like Department of Internal Medicine, is it a requirement to have the whole hospital accreditation before accrediting each department?
Okay. What hospital is this?
Government provincial hospitals, doctor.
Provincial hospital. Okay.
Yes, doctor.
Okay, that was the same questions that I posed before in 2004. 2004, when I was the chairman of the Department of Surgery of Hospital Maynila. No? Okay, I know it's difficult to have the whole hospital certified by ISO 9001. So I asked the external auditors, accrediting bodies, if we can have one department certified. He said yes. No, I think it's possible for ISO. Okay, okay. So you can have your department certified by ISO. I don't know with JCI, ACI. No, for ISO it's possible. Okay, and the expenses also will be lower. Okay. The 300,000 is for the entire hospital. So for the whole hospital, probably 50 or 60,000 at that time.
Okay, sir. Thank you, sir.
Okay, thank you for that. Ma'am Lydia has another comment. Agree with Param. We are also challenged by the infrastructural disadvantages, especially in district hospitals. However, with comments from accreditation surveyors regarding the infra issues, has made justification for funds to renovate or upgrade stronger for the hospital.
Okay,
Thank you for that.
so that's a plus side of the accreditation.
Yes.
So there's a drive for you to improve.
Stephen, sorry, has a question. Thank you, sir, for the lecture. How can we be part of the accreditation team? Oh, is there a minimum hospital level required prior to application for an accreditation?
How can you be part of the accreditation team? You mean the accreditation? You can have a project, okay, inside the hospital that you want to go for accreditation. Okay, so your hospital, I suppose your hospital is infirmary level 1 or level 2 at most. Now, level 2, level 2. Level 2 is without training program. Okay, so you can go for, I suppose you're talking about government hospital. So you go for ISO certification. Okay, let's say you decide to go for ISO certification, and then you create a team, a steering team, a committee, okay, an office, most likely a committee first now, which consists of people, okay, inside the hospital who will supervise, coordinate everything about the in the preparation for the accreditation. Okay, so I suppose that's what you meant by accreditation team. The
Sir,
intern.
excuse me. If I may, sir, I would like to ask, how can we be a part of the accreditor? On the,
Accreditor, external.
yes, sir. Yes, sir. Also, sir.
Okay, number one, you have to have training. Okay, now let's talk about, of course, PhilHealth Handbook. You have to be part of the recognized trainers or auditors of PhilHealth Bench Book. No? So let's remove PhilHealth Bench Book. You have the ISO, you have JCI, ACI. They have their own people there training. Okay, certified auditors. We call that auditors. No? So you're talking about auditors. No? Now, in the Philippine Quality Awards, also you will undergo some training, and then after training, they certify you as an auditor. Then you can become a part of the accreditation team. And the training entails some cost also. Okay, so every now and then you see in the internet before. Okay, so you have a 10,000 course fee to be a external accreditor, something like that. No? So
Thank you, sir.
Okay.
you really want to be an accreditor?
In the future, sir. In the future, pa.
Okay.
Thank you, pa.
Okay.
Okay, thank you for that. Ma'am Audrey has a question. Thank you for the lecture, Dr. Hawson. The main motivation for hospitals to apply for PhilHealth Bench Book is to be able to participate in the National Health Insurance Program. Do you still recommend PhilHealth accreditation today when the Philippines has been known to stall and delay reimbursement? When PhilHealth has been known to stall and delay reimbursement claims of member hospital. One hospital in QC already declared their decision for non-renewal. Oh, I heard about this. Due to 200 million pesos worth of unpaid claims. Whew. Very heavy.
Yeah. Okay. Yeah, I think there's something amiss in the system, but eventually it's probably a matter of bringing it to the attention of the PhilHealth people. So what has to be corrected now? And because eventually people, the Filipino people go to the hospital, no? What the hospital which are nearest to them, and then needed by them. And then most of these hospitals, if you don't have PhilHealth accreditation, as you mentioned, you want to participate in the National Health Insurance Program, so you can have some amount of income also from them. Okay, so if you're not a member, if you're not PhilHealth accredited, then the patients will just go to another hospital uh, who will persevere with all the flaws and problems of PhilHealth, hoping that one day it will improve, which is actually happening for the past 10, 20, 30 years or 50 years, okay, since it started. No? Okay. So it's really up to the hospital to make a decision whether you want to renew or not. No? But take note of the losses that you're going to have. No? Okay.
Okay, thank you for that very heavy question. uh, Ma'am Zoraida has a comment. The 14 million worth of JCI accreditation is the reason why the top management allows the more expensive procedures like robotics to prosper and sacrificing proper informed consent. Oh, I think this is a follow-up to the discussion that you had earlier about the OB-GYN, the medical tourism being prioritized by the
Oh, okay, but
facility.
even without the advent of the robotics are just recent, di ba?
Yes.
But if the JCI has been there for a long time already, so as mentioned by one of the participants, no, so you tend to increase you have to cope up with the expense with the accreditation expenses of 14 million. So where do you get it, right? So it's either you increase your caseload, your patients, followers, or you increase the cost, right? You increase the expense of the procedures. No? So those are the two possible options that you can do to cope up with the 14 million. No? Okay. So in terms of allowing more expensive procedure just because of the JCI, I don't think it's 100% correct, no? Because the management also consider what will be the return of investment if you go for robotics, right? You go for robotics, no? Just like the PET scan, now when it started, now, so what are the return of investment when you invest on PET scan? The PET scan was about 120,000 before, no? Okay. So somebody decided to take the lead and then probably earn from it already. And then more hospitals are going into PET scan nowadays. No? So it's just a matter of analyzing the so-called SWOT analysis, now the threat and the opportunities, now in terms of revenues. Okay.
Okay. Sorry, Doc, someone was asking in the chat. Wait, who was it? For the link to the Olete.
Yeah.
Sorry, I did not realize that you sent it to me directly.
Okay.
Hold on. I think no, I cannot copy paste it.
Okay.
Okay, so while you're doing that, Doc, and I apologize for the inconvenience.
Go ahead.
Dr. Iskandar has a comment. One of the good parts of some of the reviews that have been suggested in the accreditation survey, my hospital gets an additional budget from the state health department to comply with standards and specifications.
That's good.
Extra money, always good.
Okay. What hospital is this?
Dr. Iskandar?
Is this from Malaysia or Philippines?
Yeah, it seems to be from Malaysia. Po.
Okay. Malaysia. Okay. Good.
Yeah. So, from Sir Harold James, for ISO, you need to have several trainings and be part of a consultancy group. Okay. So that's to answer the question of how they can be part of the accreditation team.
Yeah. Okay.
Okay. So okay. So I'm filtering the the comments in the interest of time. Ma'am Zoraida has a comment. PhilHealth owes 1 billion to this JCI accredited medical center. So now we are asked to generate more funds by requiring us to increase number of patients, or else our admitting privileges will be put on hold. Oh. Any comment, Doc?
It's internal problem. Okay.
Yeah, but I also heard just to add to this, that it's not just one, it's a lot of facilities that PhilHealth owes money to.
Yeah,
So
we know that. We know that.
it's a big
Yeah.
problem. Yeah.
Okay.
Okay, so if that's it for the chat comments and questions. Time check, it's almost 12 o'clock. So thank you very much, Dr. Hoson.
You're welcome.
And thank you, everyone. May we request lang po, Dr. Hoson, a copy of your
Sure.
slide deck if you are amenable to it.
Sure. I've given Emer the last two lectures. Okay.
Okay.
I'll give it.
And everyone, Dr. Hoson has reposted the link to the Olete test. So you can take it after this class. Okay, people are already turning on their video, so they know the drill.
Okay.
Okay, so everyone, turn on your videos for our class picture. Okay, everyone. Okay, so 1, 2, 3. Oh no, someone is in scrubs. Okay, 1, 2, 3, smile. Okay, thank you everyone, and thank you so much, Dr. Hoson.
Can I request we put it in gallery view? It's nicer, probably. You have,
Okay.
you have a gallery view.
Yes.
Let's try the gallery view.
Okay. Okay. So one more time, everybody put on your best smiles, pre-lunch smile. Okay. So 1, 2, 3, smile. Okay. Thank you so much, everyone.
Okay.
It's 11:56. Thank you all for coming, and we hope that this session has been very fruitful. And thank you so much, Dr. Hoson, for coming. We appreciate all the effort and your presence and all the information you have given us. Thank you, everyone, and happy lunch.
Bye-bye.
Happy lunch, everyone.
Thank you, Doc.
Bye.
Thank you, Prof.
Thank you, sir.
Bye-bye.
Thank you po.